Hi, it's Dr. Wayne Whalen. I'm the Chief Content Officer for HelpWhatHurts.com. Today I just want to talk a little bit about what kind of things cause lower back pain. We know it's everywhere and most of us have had it at some point in our life and likely to get it again. So there's lots of things that will cause back pain. Most common thing is just overuse. So a strain sprain, which just means you've taken muscle tissue and you've torn it a little bit. Other things that can cause back pain commonly are degenerative joint disease, where instead of having a nice disc that looks like this, it's all worn down from overuse and age and abuse. Other things that are commonly causing back pain, facet problems, which is where the joints come together here. They just get locked up, become irritated, and the muscles get tighter and jam it up more. You can also have problems in the sacroiliac joint here, which is very common, probably one of the most common problems I see for low back pain. And if the joint's dysfunctional, it's not moving like it's supposed to, it's going to eventually hurt. It'll cause spasm in the muscles in the buttock and then also cause pain radiating down the lower back. The one you don't really generally want is disc herniation. That's what this looks like. A slip disc you may have heard of. That's not a medical term, but a herniated disc or a disc bulging can cause pressure on the nerve, and that can cause radiating pain and also cause dysfunction in the joint areas as well. There are a number of other causes of back pain, but those are probably the most common ones that people who present to a chiropractic office might have. There's also stenosis and some other things, but that should give you a pretty good idea. Now, the important thing is seeing a good provider so you can get a diagnosis, the appropriate diagnosis of what's really causing your problem, because that'll dictate what kind of treatment do you need to fix it. So what might work for a sacroiliac joint may not work for a simple strain sprain, and what might work well for a strain sprain may not work at all for a disc herniation. So it's important to get the right diagnosis in order to get the right treatment.